Hello, everyone. If you or someone you love may need nursing home care one day, this is something you need to understand now, not when a hospital social worker is asking where your mother or father will go next. Medicare may cover certain short-term skilled care under specific rules, but it generally does not cover long-term custodial nursing home care. Please like this video, share it with a family member, and subscribe to this channel. These are the kinds of Medicare rules families are rarely taught until they are already under pressure, and by then, the choices can feel very expensive. That is the part I want you to remember. Medicare may cover certain short-term skilled care. But that does not mean Medicare covers long-term nursing home living. And it does not mean Medicare will automatically pay just because someone is older, sick, weak, or unable to safely live alone. This is where many families get caught. Not because they do not care. Not because they failed their parents. Not because they ignored the problem. But because the words sound so similar that most people do not realize they are talking about completely different kinds of care. Skilled nursing care, custodial care, long-term care, rehabilitation, nursing home care, Medicaid, Medicare. Those words get thrown around during one of the most stressful moments a family can face. A parent falls. A spouse has a stroke. A mother has surgery. A father gets admitted to the hospital. Then suddenly, someone at the hospital says, "We need to talk about where they are going next." And the family thinks, they have Medicare. Medicare will handle this. But that is not always true. And sometimes it is not true in the exact situation where the family needs help the most. According to Medicare, most long-term care is help with basic daily activities like bathing, dressing, eating, getting in and out of bed, using the bathroom, and personal supervision. Medicare generally does not pay for that kind of long-term custodial care if that is the only care someone needs. Medicare may cover skilled nursing facility care for a limited time under certain conditions, but long-term custodial care is different. That difference can shock families, because when people hear the word nursing home, they often picture one thing: a place where an older person goes because they cannot safely live alone. But Medicare does not look at it that simply. Medicare asks a different question. Is this person receiving skilled medical care that requires trained nurses or therapists? Or is this person mainly receiving help with daily living? That is the line families need to understand. Because one side of that line may be covered for a limited time, the other side may not be covered by Medicare at all. Let me say that another way. If someone leaves the hospital and needs short-term skilled rehabilitation, physical therapy, wound care, injections, or daily skilled nursing services, Medicare Part A may help cover skilled nursing facility care if the person meets the rules. But if someone needs help bathing, dressing, eating, moving around, taking medication reminders, or being supervised because they cannot live safely alone, Medicare may call that custodial care. And custodial care is the part many families thought Medicare would pay for. That is where the surprise bill begins. This is not a small misunderstanding. A nursing home bill can run thousands of dollars a month. And families often learn this at the worst possible time. Not during calm planning. Not months in advance. Not when everyone has time to compare options and ask questions carefully. They learn it during a hospital discharge. When the parent is weak. When the spouse is scared. When the adult children are trying to take time off work. When everyone is emotional, tired, and being asked to make decisions quickly. That is why this video matters. Because the worst time to learn Medicare nursing home rules is when someone you love is already being discharged. Before we go deeper, please like this video, share it with someone who has aging parents or a loved one on Medicare, and subscribe to this channel. I cover information like this because Medicare rules, Social Security rules, senior benefits, and care costs are not explained clearly enough before families need them. The people who are subscribed here learn these rules before the crisis. The people who are not subscribed often learn them after the bill, after the discharge meeting, after the family is already under pressure. So please like, share, subscribe, and let's keep going. The first thing you need to understand is that Medicare and Medicaid are not the same program. This is one of the biggest points of confusion in America. Medicare is health insurance, mostly for people 65 and older, and for some people with disabilities. Medicaid is a separate program that can help people with limited income and resources, and in many cases, Medicaid is the program that may help pay for long-term nursing home care if the person qualifies under their state's rules. Medicare is not based on low income. Medicaid is. Medicare is federal health insurance. Medicare is run through federal and state rules. Medicare may cover certain medical services. Medicaid may help cover long-term care for people who meet financial and medical eligibility rules. And if your family mixes those two programs up, you can make very expensive assumptions. A senior may have Medicare. They may have paid into the system their whole life. They may have a Medicare card. They may have a Medicare Advantage plan. They may have supplemental coverage. But that still does not mean Medicare will pay for long-term custodial nursing home care. That is the part that feels unfair to many families. They say, "My father worked his whole life," or "My mother has had Medicare for years," or "She cannot live alone. How can this not be covered?" And emotionally, I understand that question. But Medicare coverage is not based on how much the family needs help emotionally. It is based on what kind of care is being provided and whether that care meets Medicare's rules. That is why families need to ask the right question before agreeing to anything. Not just, will Medicare cover the nursing home? That question is too broad. The better question is this skilled nursing facility care that Medicare is expected to cover? Or is this long-term custodial care that Medicare does not cover? That one sentence can change the entire conversation. Because if it is skilled care, you need to know how long it may be covered, what conditions must be met, what the costs are after the covered period changes, and what happens if Medicare stops paying. And if it is custodial care, you need to know immediately who is expected to pay, whether Medicaid may eventually apply, whether the facility accepts Medicaid, and what documents the family needs before the money runs out. Those are not questions to save for later. Those are questions to ask before the paperwork is signed. Because once someone enters a facility, the bills can start quickly. And if the family assumed Medicare was covering something Medicare does not cover, the shock can come fast. Now, the second thing families need to understand is that even when Medicare does cover skilled nursing facility care, it is not unlimited. This is another place where people get surprised. They hear, Medicare covers skilled nursing, and they stop listening. But the important words are not just covered. The important words are for how long, under what conditions, and what happens when Medicare stops paying. Under original Medicare, skilled nursing facility coverage is limited to a maximum of 100 days in each benefit period if the person qualifies. In 2026, Medicare says days 1 through 20 cost $0 after the Part A deductible is met, days 21 through 100 cost $217 per day, and days 101 and beyond are all costs paid by the patient. That means even in a covered skilled nursing facility stay, the family needs to know what day they are on. Day 5 feels different from day 25. Day 25 feels different from day 80. And day 101 is a completely different conversation. Because after the covered period ends, Medicare is not quietly paying in the background forever. The bill can become the patient's responsibility. Now, this is not meant to scare you. It is meant to make you ask the right questions early. When a hospital or facility says Medicare is expected to cover skilled nursing, ask, how many days are expected to be covered? Ask, what day of the Medicare benefit period are we on? Ask, what happens if Medicare stops paying? Ask, who tells the family before coverage ends? And ask, what will the private pay rate be if Medicare coverage ends and the person still needs to stay? That last question matters. Because families often think they have more time than they really do. They believe Medicare is covering the stay, so they relax. Then a notice comes. Or the facility says skilled care is ending. Or therapy goals have been met. Or the person no longer qualifies for that level of skilled service. And suddenly the family is told that the care is now custodial. That is when the cost conversation changes. This is where Medicaid may come into the picture. But Medicaid is not automatic either. Medicaid is a separate program. It has financial eligibility rules. It has state-specific rules. It may look at income. It may look at assets. It may look at transfers. It may require documents. And the rules are not exactly the same in every state. So if a loved one may need long-term nursing home care, do not wait until the last covered Medicare day to ask about Medicaid. Ask early. Ask the facility, do you accept Medicaid if long-term care becomes necessary? Ask, who helps families with the Medicaid application? Ask, what documents should we start gathering now? And ask, what happens if the Medicaid application is still pending when Medicare coverage ends? Those questions may feel uncomfortable, but they are much easier to ask before the crisis than after the bill has already started. The third thing families need to understand is that a Medicare Advantage plan may have different rules, networks, and prior authorization requirements than original Medicare. This catches many families off guard. Someone may say, my parent has Medicare, but what they actually have is a Medicare Advantage plan. That means the plan may have its own network rules. It may require the facility to be in-network. It may require prior authorization. It may review the stay and decide whether continued skilled care is approved. And even if a facility accepts Medicare, that does not always mean it is in-network for that specific Medicare Advantage plan. So if your loved one has Medicare Advantage, the question is not only, does this nursing facility accept Medicare? The better question is this facility in-network with this exact Medicare Advantage plan and has the stay been authorized? That one question can prevent a serious billing problem, because a facility can look fine. It can be close to home. It can have an open bed. It can say it accepts Medicare. But if the plan rules are not followed, the family may face costs they were not expecting. So before placement happens, ask for the plan name. Ask whether the facility is in-network. Ask whether authorization has been approved. Ask how long the approval lasts. And ask what happens if the plan denies additional days. This is not being difficult. This is protecting the family from a bill that could have been avoided with one phone call. Now let's talk about the biggest mistake families make in this situation. They sign paperwork without understanding who is financially responsible. During a discharge or admission process, there may be a stack of documents. The family is tired. The parent is scared. The facility needs signatures. And someone says, "We just need you to sign here." Before you sign anything, slow down. Ask whether you are signing only as the representative or contact person, or whether you are personally agreeing to be financially responsible for the bill. Those are not the same thing. A child helping a parent with admission paperwork should be very careful about signing as a responsible party unless they fully understand what that means. If the bill becomes private pay later, you do not want to discover that you personally agreed to pay something you thought was only your parent's responsibility. Ask the facility to explain every financial responsibility section in plain English. If you do not understand it, do not sign it until someone explains it. If you need time, ask for time. If possible, have another trusted family member review it. And if the amount of money involved is large, speak with an elder law attorney or qualified professional before making major decisions. Again, this is not about accusing the facility of doing something wrong. It is about understanding what you are signing before the bill exists. The fourth thing families should know is that long-term care planning is not only for wealthy people. Many families avoid the conversation because they think, "We do not have enough money for planning." But planning does not always mean setting up complex legal structures. Sometimes planning means knowing which documents are needed, knowing whether Medicaid might eventually apply, knowing whether the facility accepts Medicaid, knowing who has power of attorney, knowing where bank statements, insurance documents, Social Security letters, Medicare cards, and prescription lists are kept, knowing what the monthly cost would be if Medicare stops paying, and knowing which family member will call which office when the time comes. That kind of planning can save days of panic. It can also prevent mistakes, because when families are rushed, they make decisions based on fear. They choose the first available bed. They sign whatever is placed in front of them. They assume Medicare will handle it. They assume Medicaid can be figured out later. They assume the nursing home will explain everything before costs begin. Those assumptions can be expensive. So here is a simple checklist. If someone in your family is aging, medically fragile, or may need care after a hospital stay, ask these questions before a crisis. What kind of Medicare coverage do they have? Original Medicare or Medicare Advantage? If they have Medicare Advantage, what facilities are in network? Would they qualify for skilled nursing facility coverage after a hospital stay? If Medicare coverage ends, what is the daily or monthly private pay rate? Does the facility accept Medicaid for long-term care? What documents would be needed for a Medicaid application? Who has legal authority to help with decisions if the person cannot sign for themselves? Where are the Medicare card, Social Security information, insurance cards, bank statements, and medication list? These questions may not feel urgent today, but when a hospital discharge happens, they become urgent immediately. And by then, the family may have only a short time to choose. So here is the full picture. Medicare may cover certain short-term skilled nursing facility care if the person qualifies. But Medicare generally does not cover long-term custodial nursing home care, which is help with daily activities like bathing, dressing, eating, and supervision when that is the main care needed. Even when skilled nursing care is covered, it is limited. In 2026, days 1 through the 20th of may cost $0 after the Part A deductible, days 21 through 100 may cost $217 per day, and after day 100, the patient pays all costs under original Medicare. Medicaid may help with long-term care for people who meet state eligibility rules, but it is not automatic and the rules vary by state. Medicare Advantage plans may have networks, prior authorization, and different cost rules, so you must check the exact plan before choosing a facility. And before any family member signs admission paperwork, they need to understand whether they are signing as a helper or personally accepting financial responsibility. If this video helped you, please like it, share it with someone who has aging parents or a loved one on Medicare, and subscribe to this channel. Nobody wants to learn nursing home rules during a crisis. One conversation today can protect a family from confusion, pressure, and a bill they never saw coming. I'll see you in the next one.